So, this is Technomancer's Business Made Simple. I'm James Kim. This is
Maya Lim.
And we're talking with Miss Rachelle Holandez.
Dr. Rachelle.
Dr. Rachelle. Do you call yourself Dr.
Rachelle.
Rachelle? Do friends call you doctor?
No, my friends don't call me doctor.
Why not?
Rachelle.
Don't you have
Doc.
a PhD or something?
I do have a PhD, but my clients call me Dr. Holandez, and then my clients who are adolescents and kids, they call me Dr. Rachelle.
Oh, okay.
Yeah.
Okay. Does that offend you? Like, no, the regular people don't call you.
No, not at all, not at all.
I'm teasing. You know, it kind of annoys me that I graduated College of Engineering, Computer Science, and I don't get to put the word engineering on it.
Oh, because are you licensed?
You shut your mouth.
You're not. So if you're not licensed, you can't. You're just an ordinary Mr.
No,
Kim.
I'm certified. I was certified in several programming languages. Isn't that the same
But it's
thing?
because she took up a board's exam.
Yeah, I have a
Or-
PhD, and then we are licensed as a
okay.
profession.
Okay,
So
fine. You win this round. You win your technicalities.
yeah,
Rachel is from psych.
yes.
Psych. So is it like different by BS and AB psych? Or
In
is
UP,
it-
yeah, they make a distinction between the two. So if you're in the BA Psych program, your electives are whatever you want. But if you're in the BS Psych program, all your electives should be sciences. And I did not take that route because I did not want to be a doctor. I wanted to be a lawyer. And then midway through, I changed my mind because of the thought of taking Spanish, which I did not like. Because if you go into UP Law, you have to learn Spanish. You have to have Spanish units because the legal documents of our history are in Spanish.
Oh.
And I did not want
It's
to
a
do
requirement.
that. It's a requirement at our
That
time.
time.
Oo. So I did not want to do that. So I figured after my bachelor's, I'll just go with the psych route.
So that's interesting. In our legal system in the Philippines, our old court documents are in Spanish, where we obviously speak Tagalog mostly. And I've seen legal proceedings, and they're held in English.
Yeah.
That's,
Yeah. Well, because if you're studying law, you have to know the history. So even though modern jurisprudence is in English,
Right.
there needs to be an appreciation of the older documents. So I didn't want to do that, basically. So I figured, I would want to be a psychologist. And if you're a psych grad with just a bachelor's degree, you're not a psychologist. You have to have a graduate degree. And at the master's level, you can be called a psychologist. We are licensed to be psychologists even with an MA, but you're not specialized. And I wanted to specialize, and that's why I
You had
did
to
my
take a
PhD.
PhD.
Yeah.
So every professional psychologist, the one who's a practice, has a PhD, or
They should have. They should have. But because we were just newly licensed, I think a few years ago, we were grandfathered. So those who did not have PhDs but had like 10, 15, more than 10 years of experience were given a
Okay.
license. Clinical practice, most specifically. So they are licensed, but they're not called doctors, but they can be, they are licensed.
and once you get the license, that's forever.
What do you mean? Well, we have to renew every 3 years.
Oh, you have to renew every 3 years.
Every 3 years, like most of the
Now,
professions here.
question, what's the difference between AB and BS? One, you can take up medicine. The other one, it's like a prereq for, you can take up law.
Anything, law, you can go into graduate studies in psychology, you can just stop there.
But the ones in the movie, like, you would go to the psych, that's the one who graduated with BS psych or any? BS psych or AB?
Going to med school, it will be an advantage to be in the BS Psych program because you don't have to take back subjects in physics, bio when you're in med school. Okay?
Okay.
So it's just a practical thing that they did for the program. But there really is no rules. You can actually be a BA Psych graduate and go into med school. You just have to take extra subjects. But it's preparation because a lot of pre-med students would rather take psychology as an undergraduate because they give higher grades than the bio teachers, the science teachers, and in their records it just looks nicer. Yeah. Plus, aside from that, you have an appreciation of human behavior, which science students would not have.
But why does it look nicer? If you're a professional psychologist right now, you have a practice. When does your grade come up? I mean, when you were when you have a patient say, hey, look at my grade in communications 1?
No, it doesn't matter at the level of practice, but it matters at the level of graduate school.
Oh, graduate school.
Yeah,
matters?
if you want to go into graduate school, want to do your master's or your PhD in psychology, they would look at your records.
Yeah.
But yeah, you know, it's not the most important
They
thing.
can deny you?
They may screen you, shortlist you out,
Really?
or they would really give put a close, take a closer look at how you're doing. I mean, they won't be as confident in your ability to finish the program
So even
if
if
your
I
grades
wanted-
are a little low. Pero it's not parang it shouldn't. I mean, it's just something that, of course, they wouldn't say it. No, pero na that's also one thing that they're looking at.
So if I have a lot of low grades and I want to take masters, they'll say, maybe it's not for you. Or
Probably.
Really, they do that?
Yeah,
Oh, I did
they
not
would
know
say that. But if you're insistent, they would not naman dissuade you, but they will really kind of monitor you a little bit.
Okay.
Are there a lot of psychologists, psychiatrists here in the country?
There are a lot of psychiatrists because they're medical doctors. There are a lot of psychologists. Most of them, however, are not in clinical practice. A lot of them are in academe. They are
teach.
guidance counselors. Or they're in HR.
Okay.
Yeah, but you don't need a license for those if you're in those fields. Parang mas tinitingnan nila is if you're in the clinical field or you're working with children, you're a child psychologist.
So you have a lot of options if you take up psych.
Yeah, definitely.
So you highly
Yeah.
recommend psych?
I would.
Yeah.
I would, because it really broadens your perspective of what you can do afterwards. And you're dealing with human behavior, and everything that we do
Yes,
is
yes.
Has that. Now, whether you go into marketing or in politics or in literature, you have to have an appreciation of human behavior.
So talaga, you have a lot of options pala, not
Yeah.
just clinical or
Mm.
like ano.
There is child psychology, there's school
Okay.
psychology, there is social psychology, which is really very popular in the university. And in UP, under social psychology, there's Psikolohiyang Pilipino, which really looks at the Filipino personality.
Wow.
And then there's also personality psych. My electives when I was in college was not, my electives in college was in arts and letters. I took comparative literature, creative writing, and English, because that was what I was interested in.
You pretty much indulge whatever.
Yeah, I wanted that freedom, even in high school, when it was like, we were allowed to take electives. I would take the ones that interested me, even though I was really bad at them. Like I selected topics in biology because I was interested in genetics. And, of course, I was surrounded by the likes of Donna and Yami. And of course, I couldn't measure up, but, I learned a lot. So, yeah. And when going into college, that was also my mindset.
So in high school, you knew what you wanted to take in college?
Actually, I wanted to take interior design,
Okay.
but my parents were like, I think you need something more, stable. So I thought law. Okay. And then when I was in college, I felt like I didn't want to do law.
Mhm.
So
Did
I
they
changed
get
my
angry?
mind. No, they did not.
You said you're disappointing us, Rachel.
No. Actually, I was considering to shift to interior design, but parang I felt like my interest in that kind of law got lost, or I didn't want to study it. I just wanted to enjoy it. So I
So
felt
Interior
like,
design.
yeah.
So it means you went to college. You went to school for 4 years for college, 2 years for masters.
Yeah, they would give you 2 years, you can finish it full time, but they give you 6 years to finish it. Until more than that, it's maximum residency.
MRI.
And then PhD, they give you 5 years to finish it, but
You can finish it in like
10.
Oh,
But you're already at maximum residency for the last 5,
So,
which happened to me. So yeah, I studied for a long time.
But you
and
were working.
I was working.
At what point were you able to work as a psychologist? When you got your master's?
when I got my master's, because that was really the goal. I did not want to work as a psychologist with just a bachelor's degree.
Yeah.
I wanted to have an MA, and that's what I did. So when I took my PhD, I was doing it part-time. I was already working.
But you mentioned psychologists and psychiatrists. Are they? I In my mind, they're the same thing.
Yeah, they're the
Different.
same because their clients would be people who have problems with, behavior, emotions, behavior derived from the emotional issues that they have. But psychiatrists are medical doctors. They're trained to be doctors. They're trained in medicine, and therefore, when they have a license, they can prescribe. They work in hospitals. You see them a lot there. Psychologists are not medical doctors, and therefore they're not trained in the medical paradigm. So the way we study behavior is we look at their history, when they were children. We look at their environment, we look at their school history, we look at what behaviors were punished and rewarded when they were younger and even until now. So it's a broader perspective of behavior, which is not medical paradigm.
So you work with a psychiatrist. If the patient would need medication, you work with them.
We often work together. So for instance, a client with depression will be seeing a psychiatrist for the medication part. And you have to take these meds. But then the person would also need to have regular sessions with a therapist to help, understand why they're depressed or how they can cope more effectively. And a psychologist is the one to do that. In the States, a psychiatrist can do that, but not all. But then, some people really prefer another person for therapy and another person for the medication.
So if they go directly to the psychiatrist and say, hey, my son's setting fire to the school, they say, oh, talk to Rachel first. Talk to Dr. Rachel first, and then to see if there's some underlying thing we can dig up.
It can be done simultaneously. It doesn't have to be one first before the other.
But he'll refer, or he or she, the psychiatrist, will refer them to you for the therapy?
Yeah. Some psychiatrists can do therapy, but some
Depends
prefer
on their
not to.
specialization.
Oh, yeah. Some don't want to. So that's when they call on the psychologist to do that.
Question. When it comes to special children like that, do they go to SPED or do they go to psychologists?
It
Or
depends. It
Or
depends.
autism, like
Okay.
I would think that that would be different, right? Because autism is, anyway.
Well, we deal with kids with special needs.
special
So
needs.
sometimes they would be seen, their teachers would say, I think there's something wrong with your child, mom and dad, have him seen. And it's usually a multidisciplinary approach.
Okay.
So they would be seeing a developmental pediatrician who will take, the history and kind of figure out if other medical conditions could be factoring into the child's profile, like if he might have seizures, he might have, a syndrome that is causing him to struggle in school. So that one would be the developmental pediatrician. And then they would have the child seen by a psychologist for an assessment, because we do assessments, we do diagnostics.
By yourself, or is it part of a team?
By myself. Okay, so we give tests, that would look at IQ, achievement abilities, memory, attention, executive functioning, and from there we can derive a profile and see if it meets criteria for ADHD or learning disability or autism. And then if the child has behavioral issues aside from the neurodevelopmental condition, then the child may have to work with a psychologist who can do therapy with them, and that's it. If the child is struggling with school and they are in a regular school, then there would be a recommendation that maybe a special ed program might be suitable. So it's really it's a multidisciplinary effort, and it's not like one after the other. We'll do this first, second, third. Yeah, it's best if it's done that way, simultaneously. But of course, some parents have limited resources. So when they say, ano yung prioritize natin, then we would say, go to the doctor first, because we really just want to rule out if there's any medical condition that could be aggravating the picture. And then we can do the rest afterwards. So
that's a good point. Like affordability, because if you get sick, right, then you can go, if you have PhilHealth or HMO, if you have an HMO insurance, you can go to have something treated, right? How about if it's on mental health? Do they cover that?
Right now, HMO does not cover the services of psychologists, and we hope that it will change because we see a lot of children who need psychological services, and a lot of them are, it does not discriminate between social class, and a lot of them from hindi pa kami covered by PhilHealth and HMO, but we're hoping for it to change, lalo na because there's the mental health bill. And the advocacy is gaining traction. So,
what's a mental health bill? They're trying to get it covered as a medical condition.
For it to be recognized at the community level, that there are programs, there are parang community programs and services for that, and that eventually the PhilHealth will cover some of the services for that. Especially the consultation with a doctor, and if there are any early interventions that need to be done.
It's something new Like before, you would say na, ano lang to, iba-iba yung, ngayon, di ba, the development with mental health. Nowadays, people get so crushed easily. Is that, will that parang help if they go to you, psychologists, like kids, teenagers?
Yeah. Because before, we would just say makulit ang bata, malikot, or slow, yung mga ganong labels, no? But now it's very scientific the way we do it. So there is a certain point where we can say for sure that it is really compatible with a disorder. The pros and cons of that is at least there is a name. Okay, and it gives so much clarity to the parents that there is something that's going on, and it's not just because the child is like that, personality lang niya, or tamad. That's usually the labels. And we would say he's not tamad, he really has a disorder. Okay, so it's good that there is a label, and in the States, having a label will make it easier for you to get interventions and services for that. Okay. Of course, some families still feel stigmatized, especially if the diagnosis is not very glamorous. Some people would really prefer an autism diagnosis than an intellectual disability diagnosis because, autistic individuals are, genius. That's the stereotype, but, that's not always the case. And so when they get a label or a diagnosis that they're not ready for or that they cannot accept, it can be a struggle. But the end point is we're doing this for the child. We're not doing this for the ego of the parents or whatever. No, we're doing this. The diagnosis is being given because we want to help the child. If we know what the profile is, then we know how to approach. Because if we don't, it will be hit or miss. And if there are other people working with a child, like teachers or it can be very hard if they don't know what's going on.
There's to Maya's point, when we were in college, I didn't know anyone who was depressed. Maybe because it wasn't diagnosed or something. But it seems like this is anecdotal. Like my sons have friends. They know several people who are depressed. And especially in the U.S., there's like an opioid epidemic. It's something, right? There's an opioid epidemic for depression and things like that. So I'm wondering, is something going on? Why are there more cases of depression? Is that just because it's diagnosed more, or you think something going on?
It's complex. It's not just because people are more aware, therefore they're being diagnosed more.
Because like before, we didn't have Facebook, and we didn't know some things were like hush, taboo. We didn't talk about certain things, but now a lot of things are being shared on social media.
Do you think it was just as common before? They just kept under the
I'm not so sure about that depression thing.
Yeah, prevalence figures are higher now because it's being recognized more.
So is it really
it's more that's what nobody knows for sure. It was underreported probably in the past or unrecognized, but with the diagnostic criteria that we have, we're recognizing it more and more. But then there's also times are so different now. The social media is really becoming an important factor when we diagnose depression or even addiction. There is now computer addiction in the DSM.
Like I didn't know anyone who cut themselves. before? Did you know anyone who cut themselves?
Well, maybe they wouldn't tell you.
But how come now?
And they would do it.
My friends know.
They would do it live.
Oo.
Diba?
Or so maybe they're just not. Maybe it's just more prevalent. I mean, maybe they're just more public about it now.
I think it's both. It's really more complex. It's being recognized more. They're being more open about their issues, their struggles, and because of social media, you get a lot of information or see a lot of people who are also in the same boat or situation as you are. So it seems that it's not a singular factor. It's not a single factor, but it's really more complex than that. And so a diagnosis of depression probably is more articulated now than it was before. But in terms of prevalence, it could be more because social media is becoming a very important factor that they're looking into. But then, we do not know for sure. But that is one of the driving theories
for now,
right now.
you're very in demand right now. Your field.
Yes, and there are very few of us here in the Philippines.
What are your hours now?
What do you mean?
Working.
Every
Well,
day, 8 to 5?
Every day,
I
8 to
do
5?
not go to the clinic every day, but I work the whole day, writing reports,
Okay.
So every day you're working?
Yeah, I
to
have
Friday?
to.
Monday to Saturday?
Saturday.
Monday to Saturday?
Monday to Saturday.
8
Because
hours.
Saturdays...
Cases, diba?
Yeah.
You write your cases.
Yeah, and I don't just do
Findings.
therapy, I do assessment also. So I diagnose. And it's not just kids that I diagnose, I also diagnose adults. Yeah.
8 hours a day, every day? Monday to Saturday? 8
Monday
hours
to
a day?
Saturday, I work on reports. That's the largest bulk of my work.
Yeah, is it 8 hours a day?
Sometimes more,
More?
if I can, but
Wow.
sometimes
After
less
dinner.
if I really don't want to work. There are days that, I'd rather watch Netflix the whole day.
Because you
and,
can work anywhere. You don't
I can
have
work
to go there
anywhere.
for
Yeah, I
work.
control my schedule, which is
Yeah.
a wonderful thing when you're a PhD because you're at the level where you can really control your time and your workload. But yeah, there's a lot of responsibility and expertise that is expected
Why is
at
there
that
like
level.
you said there was not enough psychologists, but I know there are lots of people graduate from
Because you have to
psychology.
take masterals and then PhD.
Oh, you have to take PhD also, right?
To have the
Now.
license.
it's just
No,
like
for
masters.
masters.
For master.
But if you want to go into clinical psychology,
Yeah,
it's specialized at the
clinical
PhD level. It's
Yeah.
not special here in the country. It's not specialized at the MA level.
Yeah, it has to be PhD.
Yeah.
So that's why it's taking so. That's why there are few because the masters and PhD.
Yeah, there's a lot who have bachelor's degrees in
Of
psychology,
psych, yes.
but they're not all in the field of
Yeah,
working in the
yeah.
field of psychology. And then there's the MA, mas konti, and then PhD, even
All the
fewer.
more content.
But if there's such a huge demand for psychologists in the Philippines, especially now, ang daming mga depression scene, right? Why don't they continue and then?
Eventually, I
Because it's hard
suppose.
work to study
Yeah,
it.
diba?
It's not made for everybody. Really, because we would train people in our center to do the work that we're doing, and the attrition rate is high.
Like what?
They don't
50%?
realize. Even
80?
less.
Oh, that's
Yeah,
40.
because it really takes a certain personality or
kasi
interest
you
to do
have
that.
You'll be absorbing all those emotions, and
Is that it?
it takes a lot to be objective,
Is
to
that
be
it?
able
Is
to
that it?
assess.
In therapy, okay, when I do neuropsychological assessments, and this is like brain behavior relationship. When I do therapy, it's really the psychology part.
Okay.
And it takes a lot of training kasi to do neuropsychology. Not that there are more clinical psychologists than neuropsychologists here in the Philippines. In the Philippines, there are like 4 of us lang.
Wow.
Yeah.
So you're a neuropsychologist?
Yes.
Just a handful.
Just a handful.
OMG.
And we try to train.
We have on
We're not
this show.
worthy.
We have on this show one of
Amidst
the
us.
4
One of the 4
neuropsychologists
actively
in the country.
practicing.
Actively
Oh,
practicing.
Yeah.
We will put that in the title. Active neuropsychologist, one of the 4.
But there are more clinical psychologists, and they do, yung mga therapy. And it takes a certain amount of training and also a certain kind of person to be
Yeah.
able to do that. A lot of people think you absorb the problems, but it does. it's not like that.
Okay.
You could not absorb the problems. You
But-
can think about it, you can analyze it, you can use it to work very well with your
Because it
client.
takes a kind of personality
to be able
to
to,
work.
yeah.
But to Miss Maya's question then, are the ones who drop out because they do take it on and then they break down and say I can't and they
Yeah.
burn out.
Could be for many different kinds of reasons. Sometimes they go into psychology because they want to work on their own issues, but that's
Yeah.
not a very good
Reason
reason,
to
or it
do
won't
that.
sustain you very long.
Yeah.
Because and in the States actually, if you're a PhD, you have to have therapy while you're taking your PhD. And even as a practitioner, it is ideal that you also have your own therapist. Yeah.
Really?
Yeah.
How
A
cool
therapist
is
has their own
that?
therapist.
Yes.
So among four of you, you just like
No, we're all neuropsychologists, and there are a lot more who do psychotherapy.
So you go to a psychotherapist too regularly.
I do, well, not
Once in a while.
regularly, yeah.
Once
And it's, yeah.
Do you get depressed from this then?
No, not from my clients.
I mean,
No.
just from this.
Galing.
From the work, no. Burnt out, maybe. Like, there are days that are really very, you're very tight with caseloads and
Yeah.
schedules. And it can be a lot if that's not the only thing you're doing. But it's not like, I'm tired of this profession. I don't want to do this anymore. I don't feel that way.
You could actually scale back. So basically, where you're here, because I kind of think of you as a small business because
Okay.
you have your own clinic, you have your own hours, you can choose your hours,
What?
right?
There are only four of them.
Yeah, but there
the
are only
whole
four of them.
country.
Why ever thought of saying, hey, maybe I'll just work 3 days a week?
Okay, I have 3 clinics. One is with the Ledesma Clinic for Neuropsychological Services,
Yeah.
and that's where we really do neuropsychological assessments.
Yeah.
And there's just 4 of us actively practicing.
That is in Manila,
We're in
Makati?
Manila, we're in Pasig.
Pasig.
We're in Ortigas.
Okay.
So there. And then my other clinic is creative therapies, and that's where I do psychotherapy and play-based therapy with the kids.
Where?
In Quezon City.
Quezon City.
And then the other one is a visiting consultancy in Makati Med. Okay? So I do different things in those centers. With neuropsychology, I just see 3 patients a month. But in creative therapies, I hold clinic 2 days a week. And then in Makati Med 2 to 3 times a month. Yeah. Okay. So
you're
it's not.
busy.
I'm not like in the clinic every day, but I'm working every day.
Right. So do you ever get to the point like, maybe I'll just work 3 days a week, 2 days a week? Or is this just too much fun? Or do you feel guilty like, oh, if I'm one of the 4 neuropsychologists in the Philippines,
no.
if I scale back, where will they go? I
No.
mean, what's your thinking? How does it work?
Well, me personally, I do not want to be in the clinic every day, and of course,
But
I
you don't want
do.
to write reports every day. Maybe
Yeah, I
you
know.
do, maybe you do,
I
maybe you
should.
don't.
Well, my
I don't know.
mentor would say, maybe I should work more. But yeah, I made a decision that I do not want to write reports every day. I would write it probably. I wouldn't write it the whole day every day. I would do a few hours every day, and there will be 1 day off in the week where I just do errands and stuff.
So you-
But how's that? Don't you have an assistant who can
oh, yeah.
prepare your
Yeah.
documents, your papers, and you can just proofread or tweak the reports?
Yeah, that is the goal. And we tried doing that, but they drop off.
Miss Maya has a good
okay.
business idea.
Yeah, we've always wanted to do that, but it's just so hard. They don't sustain. Actually, I was a product of that. It was my
okay.
mentor, my professor, who took me and trained me, and then I became a neuropsychologist. And when it's second generation now, me and my colleagues have tried, but it's so we're not getting the results that we want. But yeah, technically, ideally, that should be the goal, to train people to do that.
Yeah.
Para we also
That's
don't
true.
have to do all the work.
Kasi diba in
Yeah.
the legal profession, they have the paralegals
Oh, yeah.
who
Yeah.
prepare the documents. And if it's so tasking to do those reports, it would be easy to have your writers.
Yeah, we're always looking for trainees.
Oh, okay.
And they come, there's so much interest, and then when they see that how much work it
You know,
and
you know what
is
you could
involved,
do?
it's a little
It depends
daunting.
on how boilerplate it is. Like if there are certain factors, and then you can boilerplate. You could write a program to generate a generic boilerplate, and then you can edit the fine tune. Maybe for certain personality traits, a certain number.
Yeah, we've looked into
Template.
that. We've looked into
Ah,
that.
see.
But, okay, we could not do it in terms of the template or the boilerplate could not be based on diagnostic criteria because it's going to be superficial and we will be ending
Right,
up
but then you
with a
can
lot of
edit it.
misdiagnosis. No, what we can do is, what I've looked into is you make a template or a program that is based on the clinician. What information the clinician looks at, and how the diagnosis is generated. So it's very unique to the clinician. It's not
Yeah.
something that's templated onto a diagnostic criteria. So it's really the analysis that goes into it. But then, of course, we don't know how to do that or who will do that for us. But that's always a fantasy that we have. My professor would say,
You could do that.
can you? It's a logistical regression program that we need.
Yeah. Well, anyway, let's talk after this.
Yeah.
That sounds like an interesting.
Okay, because my mentor would say,
interesting.
our field is so important, and then you do not want to be replaced by a robot.
I
But
don't think you
sometimes I'm
ever-
thinking, I wouldn't mind being replaced by a robot if it don't mean I can have more time for
I
myself.
really don't think you can be. But there's some things but we should automate the parts that we
You can.
can automate, and then so we can concentrate on the parts that cannot. Like for example, we automate the payroll systems, right?
Yeah.
But it doesn't mean like there's no one creating the payroll. Someone still has to create the payroll. Someone still has to review the hours. Someone has to approve the loans, or
Yeah.
someone has to make a decision if the loans exceed the actual salary.
Yeah.
Someone has to say, hey, how come you're charging 3 minutes of overtime every day? Maybe you're just standing by the Bundy clock. Yeah, you go first.
Yeah, it's nice.
Right.
I mean, there are parts that we have somebody do like the scheduling and
Yeah.
creating our database, but the actual report writing, because our readers are not just the parents. It's sometimes the other doctors in the team or the
Yeah.
teachers, and if they see that the template, it really is very unique to the clinician. Because if we do something that makes it look like it's a mill,
Yeah.
it's very generic, they will not appreciate the
Sure.
service and they will not respect the profession.
Sure.
So if you, like me, when I would read my colleagues' reports, it's very unique. Their style is unique, their language or how
Sure.
they try to explain case profile is different. And I'm sure my mentor, when she would read our report, she knows, oh, this is from Rachelle, this is what this
But you
did
can
and what.
tailor-made it
Yes.
for
Yeah.
her. Business made easy.
Yeah.
Simple.
Business made simple.
Yeah.
Yeah.
I'd be, I'd be open
It's
to
not a sales
that.
pitch. Let's talk about go back to you. So another thing I also noticed, like in the U.S. when my son was growing up, he was very kind of
Who
had
was
a hard time paying attention.
your eldest?
Joshua. Yeah.
Ah, okay.
So his teacher was recommending us to go to bring him to a psychiatrist, and then he was just kind of implying under her breath that I don't know if I think she kind of said it. Maybe he needs some Ritalin.
Ah, okay.
And then I also know another kid. Just for the audience, Ritalin is a drug that helps
For ADHD.
for the ADHD calm them down.
Yeah.
But it's basically speed, right?
No, it's hyperactivity.
No, I mean the Ritalin.
Oh no, it's not. But it's derived from a common substance, but it's
But it's
formulated,
Formulated,
differently.
unique, different,
Yeah.
but based on speed. Okay, and then there's another girl that Josh was classmates with in his Taekwondo class, and then the mom was relaying that how her daughter was put on Ritalin also, and then her daughter became a different person, and so she decided to take her daughter off, and she feels like her daughter's doing much better without it. So I don't know. What are your feelings about that, drugging up the kids? It seems, I don't know. Do you think it's overprescribed, underprescribed? I've heard both arguments. In the US
Well,
and
the
the
drugs are
Philippines?
newer now. I mean, they're always, making the formulation safer and more tolerated, especially if these will be taken by
Younger kids.
children. Okay, and they're really
Overprescribed, underprescribed.
in the States, it's overprescribed
You think
because
so?
of the health insurance system. The health insurance system is very vulnerable to that. Here, maybe not prescribed as much, where sometimes kasi we see that the child really needs it and the parents don't want. And it's very hard to see because the child is struggling in school and the child wants to focus, and he's not being given the medicine that he may benefit from. And it's really educating the parent that, it's okay. You can take him off the meds during the weekend, during summer break, but when he needs to focus, he can benefit from that. Because what does the medicine do? So for Ritalin, for example, it helps them focus. And if they're able to focus, they're able to learn the lecture, their lessons better, and they feel better because, I'm catching up with my classmates. Whereas if they're off it, it's very, very hard for them to focus. It's always a struggle, and then they see their classmates doing okay, and they're thinking, why can't I be like that? So it's a balance. There are kids with ADHD that may not need Ritalin because they are
So it's not
able.
automatic.
Yeah, if the child is able to figure out his own strategies, and if the school their method is more open or they're more progressive, then maybe the child does not need it. But if the child is really struggling and the school is not matched to those needs, then we would suggest that either you change school, or if you want him there, put him on medication.
Good point there, no? Sometimes the parents, they don't like to give medicine.
I don't.
But kasi
But,
di ba?
but maybe I should.
What if
In
you
some
need
cases,
to intervene?
Yeah.
At a certain time, you cannot
Mm-mm.
intervene anymore. It's better if you do it when they're still younger or something like that.
It really depends because ADHD has different levels. It can be very mild and it can be very severe, and it will be really very hard. You're subjecting the child to so much struggle by withholding medication. And then, the child would evolve to have all these emotional issues that come along with it. But if we look at the bigger context of where the child is situated, then it's easier to make a decision. And we would tell the parent na parang it's not forever. Because the point of medication is just to help with the focus while the child figures out his or her own strategies. When the child is able to figure out his or her own strategies and knows, what they're capable of, these are my strengths, these are my weaknesses, and therefore evolve their own strategies, then probably he can be taken off. Yeah.
Oh, they can.
Yes,
What-
they
what-
can be taught how to and ADHD is actually not so bad as some
What
people
they
might think,
Yeah.
because we've had patients or children who had ADHD not on medication, but they really figured out their way. They discovered the methods that are effective for them, the jobs that are suitable to them, and they are successful.
What percentage?
Whereas there are others who really need it. Okay,
What
and so
percentage do you think get off?
I have no
50%?
idea.
Pero
I
kasi
have no idea.
for the well-off, they can be diagnosed, but we have a lot of public schools and a lot of students
Mm-mm.
might have ADHD and yet sasabihin makulit lang.
Mm-mm.
Diba? So,
Yeah, when medication is hard to come by, then the non-pharmacological intervention can come in. So they can work with an occupational therapist to do, to address the hyperactivity, or really look for a school that is more progressive, lower teacher-student ratio, or find something that the child can do so that the hyperactivity and the attention deficit can be addressed while still continuing to be in a traditional school. But it will take a lot of creativity, and this is where the clinician and the parents really have to work very well together. There should be close communication. They should be thinking about different ways to help the child if medication is not an option for them. So, but it can be done,
How can they, like you said, there's no PhilHealth, there's no...
Yeah.
So how did
they can afford
person,
it,
they can't afford
an
it. What do they
ordinary
do?
person.
The therapy or the diagnosis?
They can't afford the therapy or diagnosis, right? Because it's not covered by PhilHealth, it's not covered by HMO.
Sometimes we would tell them, basta have an evaluation. Okay, have an evaluation because the evaluation report will detail specific recommendations that can help the child. Okay, so it doesn't always have to be medication. Actually, when we make the reports, the recommendations don't stop at see a doctor, do speech therapy, there are very specific recommendations about what can be done at home, what the child can do, and these are very targeted recommendations. And so we're able to help those families or help those children even when they may not have all the resources available to access these services.
By the time the kid goes to school, that's the time the teacher can help assess. Because if you're a parent, you wouldn't know. Sometimes you'd think that, okay, makulit lang yan. He's just like hyper. But I think the teachers will be able to tell if the kid needs assistance.
Right. The teachers are very valuable. Doctors also, because sometimes the parents are oblivious or they don't see, because they don't see as much kids as teachers do, as much as pediatricians do, and also as much as neuropsychologists do. They're only limited to their own children and the cousins, whatever. So it's not a lot of kids. So sometimes it's harder for them to pick up on those things. But a teacher would be good. No? What the teachers do kasi is they look at behavior and, in the cohort of the other kids in the class, they can make those comparisons. But it's at the level of behavior. What neuropsychologists do is we look at, brain systems and, the profiles that drive those behaviors. So we look our appreciation is a little bit deeper. And then, more than the diagnosis, the recommendations is an important part, because that is actually the most useful part of the diagnosis or evaluation for the parent.
What to do next? Yeah,
what to do next, what you can do at home to help this child, what can be done in school to help this child. If the child is in a good school already or a suitable school and they have resources, then avail of that. You don't have to look elsewhere, or you don't have to look for additional interventions or services. But of course, there are children who have so many needs, and probably SPED would be the best, or a more less traditional approach to schooling would be.
Do you have patients for special education, or are they mostly special education, or special education goes to a different kind of
Mixed.
It's really mixed.
Like I have clients with ADHD. Some are in a progressive school and some are in a traditional school.
And you have adults.
And I have adults who have been diagnosed as children with ADHD, and some have been undiagnosed, and we're diagnosing them as adults to have ADHD. Because in their history, when we look at it, nalagang they fulfill all the criteria, and then now they're having problems at work or in their relationships, and we're able to tease that out and see if it's really ADHD or it's like other things that might be contributing.
I want to share this, a little plug for IT, for computer science, for my course.
Okay.
I have worked with several people. When I started working, I would think they're just weird or unusual, and then as now I've seen more people, I realized a lot of them are on the spectrum. I don't want to say autistic. Maybe they are, but they're on the spectrum. Like we have this one guy who's very literal. People listening will know who he is. He would we go up to him and then he'll say, "Hey, where's Fred?" And then he'll say, "I don't know. I'm not his dad." He's not being. And I heard about that because they told me, and because he's saying, "Wow, what an a-hole," right? And it turns out no, he's literally, that's what he really feels. Like if you bump into him in the corridor, he won't say anything. But he's a very smart programmer. He's very good. And the other thing about him also is that the most noticeable thing was they were in the office, and there was a error in the program. So the business analyst went up to him and said, "Hey, there's a problem." And they said, "Okay, I'll take a look at it." He was taking a look at it. She goes past her desk and then wondering, "Hey, why isn't there any news, right?" So she goes back to him, and he's gone. He's literally not at his desk. And then so she freaks out. She has to find another programmer to fix it. And the next day she asks, "Where were you? Weren't you looking at the program?" "No, I was." Then it was 6 p.m. So I left.
Time to go home. Yeah, those are the hallmarks of people individuals in the spectrum. And yun nga if
but
there
they
is
can work.
they
They're
can
fun-
definitely,
they can
and
function.
that is what we want, right?
Yeah.
Even though they may have certain challenges, and for us it's not even a matter of we have to make them normal. It's really tapping into their strengths. If this is their interest and this is their passion, then they can definitely be successful. And the label of ADHD or autism is just one small part of them. It can explain their behavior to a certain extent, but they are truly more than just that. And so we would tell parents, yes, he has ADHD, or yes, he has autism, but that's not all he is.
Yes.
Okay, he has these strengths, and we look for a school, or we try to adjust things in the environment, in the home, that will really bring out those strengths, tap into those strengths, and then the challenges that they have, how to support that, or how to kind of manage that, because they can be really upset when the structure is changed last minute. Okay, so how, instead of scolding them na, why are you mad, or parang, oh, we have to adjust kasi, really arguing with them. The approach would be, next time, give them enough lead time. Okay, so that's all they need. So making those recommendations or communicating that to the parents is very helpful, because once they're able to do that, once they're willing to do that, they can see a change.
That's a good point, you look for their strengths. So it's not like if you're born that way, parang you're not part of the society. You can still be productive and you can still contribute.
And actually, their contributions are very unique. Those in the spectrum, because before, siguro in the past, we try to train them or make them like the others, and that's so unfair, because that's not them, and you're really missing out on what they can truly contribute. So definitely they can go to school, they can work, and there are adults that we see who may have been undiagnosed to be in the spectrum or in ADHD, but they figured out, they discovered their way, their strategies, and they're successful.
So that guy, I just want to emphasize, I'm not bashing that guy, because that guy, I think that was more of a misunderstanding when she told other people. It's like, oh yeah, that's you just have to keep that in mind.
Right.
You have to be very explicit about things.
Yeah.
And then, so now she, and he's been in that same company for years.
They're very, For
years. So they know how to deal with him. That lady was just, I guess, surprised because she thought it was common sense. But and then I know several like that. And then one of our clients right now, he's doing the payroll. He's one of the most, he's on the spectrum also, but he was one of the easiest to train. I mean,
he got it right away, right?
Got it right away, and then he just uses it right away, and that's it. There's the minimal. He doesn't even have any questions. We told him once, okay, got it, and then that's it. So he actually learned very fast.
Yeah, and the language of programming is very
black and white.
Yeah, it's very. They take to it very well, and so. But not all autistic kids are like that. Some are more inclined in the arts, and we see their strength there. And some are also inclined towards, popular culture, and, for sure, let's develop that, right? Instead of saying, no, you can't do that, right? So,
what do you think about what do you think about in UP? I've been hearing there are more cases of depression, and they've actually know some cases of suicide.
That's an emerging problem.
See, it's emerging.
A challenge.
Right? So why is it happening more? So it is happening more now.
Well, it's actually maybe they're coming out more.
But the suicide thing.
In the past, kasi, most suicides are not done in school kasi. They happen at home or outside of the campus.
Don't talk about it.
Right. Or the way they so when it's reported, it wouldn't it's medyo indirect na parang linking it to whatever.
Oh,
to
and
the
it could
school.
also be that the news doesn't spread as much because there's no social media. Before.
Yeah. Actually, in UP, there is PsychServe, and these are counselors and therapists who are stationed in different parts of the campus. They're still in Diliman for now, and that's their mandate.
So
they provide psychological support.
Psychologists.
Yeah, they have rooms in engineering and science, and of course in the psych department, because that's their.
Do you think college is maybe just harder now? My son's taking up computer science, and his computer science in his first year, second year seems harder than what I took in my first year, second year. And he called it, they're like, what do you call it? The course, the ones that are screening courses, the one that...
Prerequisites?
No, there's like, there's a word for it. It's just like a screening course, so that those who are not a fit for, instead of discovering in third year or fourth year, they subject you to the grinder in the first year, second year, to weed out courses. And I think that's
you didn't have such courses.
Weeder courses. I did not.
First 2 years we just had the GE subjects.
In my first year, I had the CS12, and my programming was like palindromes. Make this sentence, see if the sentence is a palindrome, the same forward and backward. And he was required to make like a much more complicated algorithms. It's like I said, that's like third or fourth year subjects, and he said they want to weed it. I get it. Maybe they don't want you to go all the third year or fourth year and says, oh, this is just not for me.
But I think in all subjects, in all courses, everything has become more. It's harder. More than that, I think it's the core, the attitude. I don't know.
So is it?
Because like they get what they call it, nadudurog. They get so crushed easily. Before,
we had harder.
I'm not so sure if it's the courses or if it's the how we socialize. Now there's the internet. You have the gadgets. Do they really hang out? Do they really have social support? Do they really talk or hang out? More than that, I don't think, I'm not so sure kasi the ones who take their lives, hindi naman yata sa school. More of acceptance ng friends.
Yeah.
Not grades.
Yeah, I think it's, again, it's multifactorial. Content is much more now. And I think that is why courses are harder now. And the demands of school are just so much different than when we were students. So thank God we're old, right? Pero yun na nga, is it...
Like for my son, it's like it feels like his course seems harder than mine in the first 2 years.
It probably is. I would say it is. Because there's just so much content, so much information, and the technology has advanced compared to when we were students, and so it's harder. And therefore...
That's the problem. Maybe we're dumping too much on...
Yeah, or probably making the expectations too hard to reach. Probably it's also parang useful to see what is really more important. Like, is it the gadgets? A lot of parents think it is, but maybe it's not. It's just the most salient thing.
I strongly disagree that it's gadgets.
Yeah, because probably it is how are we teaching our children to think? How are we training them to problem solve?
I'll give you a little quick story. So before, my biggest stress was when they wrote something on blackboard as writing, and then as the teacher was erasing it, and then oh my god, he erased it. Like
they can just like
copy. No, they just take pictures, or they can record it. And then before I couldn't look up something, it's like, what's the capital of Russia? I don't have an encyclopedia at home, right?
Yeah.
Or a definition of a word. I look at my little mini dinky dictionary, and it's just like remember our dictionary is like very small. Now you can just Google it, and you'll find you see how it's pronounced, you see all that. So all that accessibility. And before, if I had a question, Maya would know this. And then I call Maya's phone, and then busy or party line or something, right? Or you're not home, right? Now we can just message
that
you.
That just dates us so much. Yeah,
it's easier.
It's easier. Yeah. Pero yun nga, parang are we just looking at it at the level of content? Because siguro nga, what might be more important to look at is how are they thinking? How are they problem solving? Whether it's academic in nature or in the family that there are problems, how are they trying to figure that out and looking for solutions? And it's not just I know the pronunciation, I know the facts, but what do you do with those facts? How do you make those facts serve you so that you can come up with a solution, or you can come up with an original idea? Because it cannot just be encyclopedic, and although it's certainly easier, parang with these children, it's like, do you know your lesson? But what medyo missing is, why do you think it's important? How can you make it more, that knowledge or that information valuable to you? And so we're really training the children to think, and even
how to process,
and even when it comes to personal and emotional issues, how are they dealing with it? Are they thinking about it in a way that is that can meet the parang they don't have to know anything about depression or suicide, but they know how to look for solutions. They can, they'd be willing to risk certain strategies just so they can, solve their problem. And maybe that's where the depression and suicide they're not, parang their coping is a little bit hard.
The number of cases you hear every month.
Because the pressure is just so much. It may not be parang it may not be school that is causing it, but because they are school age, they are dealing with a lot, and it may not necessarily be school. They probably love school. It might be at home, but they carry it out in school, or it might, or whatever it is, right? So things are just a little bit more,
So what's the solution? What do you feel about a patient who's depressed? What's the most common?
Do you have patients? Do you have depressed patients who go to your clinic?
Yeah.
What's the most common way to address that?
Well, we need to understand where the depression is coming from, because not all depression is not the same with everyone. It can be rooted in different things. So for one client, it might be rooted in familial expectations, and that they're not good enough to meet those expectations. Another one is there was a traumatic incident in childhood and it still lingers. So it's different. So once we know what is driving the depression, we're not dealing with the sadness or the symptoms of depression. We're looking at what's driving it. Then we know how to approach it.
What percentage of it do you think is like a chemical imbalance, and what percentage is it because of life event?
Psychological.
It's not that easy. Yeah. Usually kasi parang we don't know which came first, because they feel sad, therefore it changes or it alters the neurotransmitters in their brain, or one over the other. But regardless of if it's the organic thing or the psychogenic thing, some of them would really benefit from medication just to stabilize the mood, because when the mood is stabilized, it's easier for them to think. It's easier for them to think of solutions. It's easier for them to cope. And if they're in school, it's easier for them to function in school. Okay.
So again, parang your job and the psychiatrist's job, they go hand in hand. Kasi medicine and...
Yeah. And sometimes in my work, like I'm working with a teenager who is depressed and I feel would need medication, but then the family or the patient is against it. I would say, okay, but at the end, I really feel that you may need it, because it will just make the whole therapeutic process a little bit easier. Because without it, it's a lot of struggle, it's a lot of work. I'm not saying that you won't ever cope with it, but it will take us a little longer to achieve that. And I would tell them, the medication is not going to cure your problems. Actually, it won't. It just helps them, feel more relaxed, more settled, so that they can function. And when they can function, then they feel better. When they feel better, then they're able to, deal with their depression more productively. So,
what was your most challenging moment in your career? The one that almost broke you? The one that said, why am I in this business?
Oh,
there is one. Okay.
Well, there are a lot of challenges, and it's always when these are cases where I really feel that I do not know enough of that case or of that, and so I really have to study it. But it's not to the point that I would just say, I'm not made for this, I don't want to do this. It was never a question of that. It's like, I don't know enough of this profile, so let me read up on it, or let me consult with others who have worked with this, and then really.
Have you ever walked away from a client and says, I can't handle this? Or because, not necessarily because of the client.
Rachelle is too cool for that.
I was really challenged with my first encounter with borderline personality disorder. And I've heard what
What
It
is that?
is.
What is that?
It's like the borderline personality disorder. It's like in between. They're almost in the psychotic.
Split personalities?
No, naman. It's like they're not yet. Because they are psychotic,
About to be
schizoid.
psychotic.
Yeah. So about to, but they're not yet there. And
okay.
it can be. I've heard the stories that they
Can
can
be
be the most
dangerous.
challenging to work with because nga it's so borderline, you know. And so that was the first time that I was really challenged by that. And it can be daunting if you're just looking at the label. But what helps is if you really look at the person and really try to understand that person, regardless of what the diagnosis is, it's just so much easier. Of course, you know, there is the technical aspect, you know, what strategies work, you know, what is the approach to therapy, but you can't just do that. You have to really know the person and really
Study, you have to
understand,
study.
really create that relationship with them.
Speaking of which, if you've been dealing with borderline psychotic, have you ever been in physical danger then? Like someone bit you or slapped you? No, I mean seriously, you're the way she's describing it.
No.
Never?
No. But sometimes, like if they're kids, no, if they are kids or teenagers, and there is that history na nanakit ng ibang tao, no, I would tell the parent, you know, have you seen a psychiatrist? Because if there is threat to harm others or themselves, go to ER. You know, go see a psychiatrist. Once that's addressed, then we can continue with therapy. So yeah, and it's not. I would tell the parent. Pero if it's an adult, was I ever in danger?
Yes.
No.
You seem so cool and relaxed.
Diba?
Have you ever lost your temper? Maybe that's why she
Diba,
makes a
that's
good
why-
psychologist.
Yeah, that's why she's
Have-
like one of the 4 in the country.
The 4 neuropsychologists in the country.
Neuropsychologists.
Is that why? Because have you ever lost your temper
To a client?
with anyone?
Oh yeah, my husband. But,
How do you lose your temper? What do? You
Shoot.
say that is not appropriate.
I'm going to throw out your shoes.
I'm going to throw out your shoes.
Have I ever? Well, of course I have.
Bad.
You know, if a psychologist says they've never lost their temper, they're lying. But
I cannot imagine you angry.
Diba?
I cannot imagine you angry.
you know what? When I was a kid, I was really quite difficult, and you can ask my mom about this. I
What,
was
grade
the
two?
most moody, temperamental child.
Too?
No, I was like 7, 8 years old.
Doesn't
And I
count.
remember always feeling so angry at that
Talaga?
That doesn't
time.
count.
But then, you know,
Alright.
I evolved. No, but I think I see glimpses of it once in a while.
What's
But
the worst
yeah.
you've done when you've lost your temper? Come on, let's go on.
But never as a psychologist.
Okay, never as a psychologist.
Yeah.
What have you done? With
And
your-
I can switch it off like that, you know.
Okay. I believe maybe I think that's why you're successful as a psychologist, maybe because it looks like you keep you seem very logical and calm and keep your emotions in, you know, there's like a
Yeah,
wall
you
between-
have to switch it off because you cannot take or parang
You can't take it against
take the
them.
psychologist role into your personal life
Yes.
because you won't be effective in that personal
have to
role,
be
and it
objective.
is a disservice to your profession.
Oh,
And the same way, you know, if you're working with a client, it's not about you. You can't take things personally. If they do things or say things that are insulting or whatever, you can't take it personally. You're there as a profession.
And you know they have a mental issue. That's why
Yeah,
they're
sometimes they
seeing
have
in the
mental
first place.
issues. Sometimes they have conditions,
Yes.
illnesses, right? And they're not able to screen themselves very well.
Maybe that's why the ones who don't. Maybe that's why they have a high attrition rate. The ones who can't
Yes.
separate. I would imagine. I don't know if I could.
Compartmentalize.
I don't know if I could. They probably bow out.
Probably.
It's
yeah.
probably like the same one. The doctors who can't stand the sight of blood. Right?
Yeah.
They stop being doctors.
It'll be hard to be an empath.
Yeah.
Right. Or they work in the
I'm
lab. Or they work in radiology and just look at
Did you know
X-ray
doctors
films.
as an industry, as a profession, doctors have the highest suicide rate?
Yeah, there's so first of all, yeah, there's a lot of pressure, and of course, there's sleep hygiene.
Yeah.
You know, even medical residents, they need to sleep, and the expectation for them to be on duty 24 hours is just counterproductive,
That's one.
and it's not fair
That's
to
one.
both patient
It's
and
more
doctor.
than 24 hours.
Yeah,
diba?
it should stop. That thing should stop talaga.
You don't
Because
have
we're really looking at the field of sleep study is really giving us so much evidence
Yeah.
that you cannot just think of sleep as rest. It
Yeah.
is is really there's a neurological basis to that, and it can really affect behavior in profound ways.
And the other two that I heard was because like when they lose a patient, it breaks some doctors down. Like, oh God, I should have, you know, you can say, well, you did your best, but guilt, right? I mean, that's
right.
the person's life.
And they do need therapy, and parang siguro therapy should not be looked at as something that only those who have psychological problems should avail of. It should be for everybody.
So do you have like that? You want to go on vacation and they're like, Dr. Rachel, please don't go.
Well, fortunately, our cases are not life and death. So we can really parang set aside time. And for me, kasi parang I really have to say I don't want to see any patients this month, and I don't.
Oh, you do? You're able to do that?
I can do that.
Look at her face. It's like,
Yeah.
I don't understand those doctors. Just say no.
Yeah, and probably, I can't also take myself too seriously. I think, I can save everybody or whatever. It's shouldn't be like that. So you kind of have
you need to decompress yourself.
Right, or I can't force myself. If I really think I won't be the best, I can't do the best work during this time, then I won't force myself to do that. And I will say, I'm gonna skip some patients for this month, stuff like that.
Kasi not life and death. Like, it's not like, it's just OB, anak, or surgeon. At least sa kanya,
Depends.
she has an option.
What if the patient's like depressed and suicidal and says, if you leave,
go
I will
to the
kill myself.
Go to the ER. That's always
medicine.
So, medicine.
I think it's her personality. She knows how to separate her. She knows how to balance.
Right.
things.
And if
Thank God
I
I'm
guess.
in IT. I don't think I've killed anyone. I don't think I have yet.
Right.
There was that Y2K thing, the Y2K.
Yes,
They thought
yes.
like all these programs would crash, and
Yes.
planes would crash, and
Yeah.
phones, and actually bought an extra phone because they said the phone system will break or something. Spoiler
Did it
alert,
actually?
it did not. It did not.
It's a fear of the
It was a
unknown.
fear of the unknown.
Right.
Yes.
So, if you have students who are interested in becoming psychologists, would you recommend it?
Well, a lot of people want to be psychologists,
clinical-
and
clinical
clinical.
psychologists.
Yeah, there are a lot more
Would you?
clinical psychologists, and there are a lot of centers and professors who train very well, in the
Would you recommend
university.
it for a
Um,
kid coming up these days?
Yeah, it's
Yeah.
very timely.
yeah,
There's
there is
demand.
there. It is if it is really something that you want to do, and you are passionate about it, and you're committed to really grow in that profession, then
But-
for sure. But don't do it for personal reasons,
Yes.
because it won't sustain. Or parang if you're going to do it for personal reasons, you have to come to a point and say, when is it done? And I'm really going to pursue this
Yeah.
for real, not for selfish reasons or for personal reasons.
And then,
Neuropsychology, on the other hand, it's a little bit tough, but those people are out there. It's probably we're just not as popular, or people don't know that there is such a thing. So, but
That's
there are
pretty
people
Yes.
out there.
If you have only 4, then you can pretty much demand whatever amount of money you guys want, right?
Yeah, we could, but we
then
also
you
don't
feel
want to
like,
be very
Yeah, you feel.
exploitative.
That's the guilt thing, right? I mean, I think Dr. Sammy Ang, my wife's doctor, I hope he comes to this podcast one day. But he could theoretically charge whatever he wants, right? Because the demand is so high. But I guess there are these people who just they want to serve.
Yeah,
They
kasi
don't-
more than
they
the
don't want to
money,
charge.
you
Yeah.
want your patients to be cured, to be healed,
To be happy, to be-
Yeah, you want to
healthy.
be relevant, right? You can't be so expensive, and people will just look at you and like nothing.
How do you guys decide your rates? There are 4 of you. Do you talk amongst each other and
There
see?
are other centers that do assessments. They don't do neuropsychological assessments, but they do other types of assessments, and sometimes we kind of use that as our gauge. So a little bit higher than them because we offer a more specialized assessment. With therapy, however, it's a different thing. We're not yet, hindi pa kami naka-cap sa PRC for how much we can charge. But yeah, there are more expensive therapists than others. And for me, parang I benchmark with my colleagues.
existing.
So the PRC can caps rates in the Philippines?
They should be able to do that. They're looking to do that.
What's PRC?
Professional Regulatory Commission.
Oh,
They're
so-
the ones that give the licenses.
The licenses.
Oh, I
They
did not
regulate
know that.
professions here in the Philippines.
So they can cap rates for certain fields.
We want to do that. They're looking to do that.
Okay.
Because you don't want to be exploitative. You don't want to exploit patients.
But you also
of
want to
their
give.
money.
You want to also give. Well, I guess that's a deep argument.
But sometimes, parang in some professions, I think their associations, their professional associations, do that. They function in that way, but not all. But yeah, that's what I know. We actually neuropsychologists the assessment can be a little costly for some people, but yeah, you're right. We can charge as high as we want. Actually,
They're
one
just
time,
theoretically.
yeah, there have been a few practitioners from abroad who would come and do assessments with all these oligarchs, with all these rich
Oh,
families,
yeah.
and they're really charging so high. And me and my colleagues were saying,
But you're not doing that because
but
you're doing
our
this
clients are not
because
them
you
and
wanna
cannot
serve-
afford that.
You want to help your
Yeah, definitely.
fellow neighbors
Yeah.
and countrymen. So because you're a nice person and decent human being,
Yeah.
thank you. Thank you for charging.
Oh well.
So when I said you're a small business, you kind of winced a little. You don't consider yourself a small business?
It's hard to consider
What's
a
the difference between
clinic
you
as
and a
a small
web developer?
business. Oh,
Well, if someone asks me, can you make a website for us or a small business system? I basically charge something, and they can shop around with other companies. We have our reputation, we have our portfolio, so do they, and they eventually decide which one they're going to go with. What's the difference? Isn't that the same with you?
it's service, and
Yeah, we're both
it is
service-oriented.
more. It is not systems kasi what we're talking about Now you can replicate the system or parang scale it. We're dealing with
Or Dr.
person's
Samian.
life.
Oh, yeah, Dr. Samian.
right.
Basically, it's professional fee. He decides his professional fee. When you visit him in the clinic, he decides how much his fee is. Isn't that? Oh wait, but then you say you're both doctors. Never mind. I have to compare it to me. But isn't that the same thing? Because you decide your rate. You decide how much
If it's a business. If she sees it as a business.
Yeah, but isn't it a business?
We do want it to be financially viable because nobody would go into the profession, or the profession won't sustain itself if it's not financially viable.
Yes.
It can be financially viable, okay, but it really, because there is a service ethos to what we do, then we could not do it in the way that other businesses do, like those who
Charge
deal
really
with
high.
Really
merchandise or systems,
Yes.
because we're dealing with people, their lives. So it's different
It's
in
more
that way.
personal.
So sometimes, like in the many centers, there are therapists, and how they make themselves financially viable is they give talks. They have seminars, or they have all these training modules, and you can make money like that.
And they charge.
Yeah, they make money from that, and that's fine. But yeah, when it comes to the therapeutic relationship, then that's different. You could not, unless you really charge very high because you're super good, or your clientele is the upper 1%, then yeah. But otherwise, if you really want to serve the public,
I guess what
then
you're
you
saying
can't do
then
that.
is, my business is not as personal because we make a system which may make their lives easier, but it's not life or death. Again, I hope. In your case, it's very personal,
Yeah.
so that's why. Okay, fair enough.
Yeah.
Okay, well.
I don't know if you have any more questions
I
after
don't
that.
have any more questions. Any more
Well, it
questions?
was very enlightening.
When we invited you, you said, "Oh, why would anyone want to listen to a psychologist?"
It's very
Because we didn't talk about
interesting.
business so much.
But it is a business. This is the business part.
Well,
of
there is
it.
a way to make things financially viable, and I do that. We try to do that in the center. My other colleagues, I know how she does it in her other center, and it's really, there are ways to do it.
And you can just charge a higher number, but you won't because you're a good person who wants to serve people.
Maybe. Yes.
Yes.
Good job. Good job. Okay.
Okay.
Oh, thank you so much, and well, hopefully people will listen to that interesting story. I found it interesting. I learned more about psychology than
Yeah.
Thank you for having me.
All right. I guess that's it. Thank you.
Thank you.